Rheumatoid arthritis. 10 early warning signs you shouldn't ignore. Are your joints feeling stiff, achy, or swollen, especially when you first wake up or after periods of rest? These subtle signals could be your body trying to tell you something important. Before we delve into 10 crucial early warning signs of rheumatoid arthritis that you absolutely shouldn't dismiss, please remember this video offers general information and should not replace the personalized advice of a qualified medical professional. Recognizing these signs early is key for timely diagnosis and management, which can significantly impact the course of this condition. If you recognize these symptoms, it's crucial to consult a doctor for proper evaluation and a tailored treatment plan. Resources supporting this information on rheumatoid arthritis can be found in the description below for your reference. Welcome to our daily health. Let's take a moment to understand what rheumatoid arthritis truly is. Unlike wear and tear arthritis, osteoarthritis, rheumatoid arthritis is an autoimmune disease. This means that your body's own immune system, which normally fights off infections, mistakenly attacks the healthy lining of your joints, known as the synovium. This attack causes inflammation, which can lead to pain, swelling, stiffness, and eventually, if left unmanaged, joint damage and deformity. Because rheumatoid arthritis is a systemic disease, it can also affect other parts of the body beyond the joints. Recognizing the initial subtle clues of rheumatoid arthritis is vital, because early intervention with appropriate management strategies can help control inflammation, slow down joint damage, and improve long-term quality of life. Here are 10 early warning signs of rheumatoid arthritis that you shouldn't ignore, explained in detail. Number 1. Joint pain affecting multiple joints, a widespread rheumatoid arthritis sign. One of the initial and most significant indicators of rheumatoid arthritis is the presence of pain in several joints rather than just one. This often begins in the smaller joints of your hands and feet, such as the knuckles, the joints in the middle of your fingers, and the joints at the base of your toes. The pain is typically described as a deep ache, a throbbing sensation, or a persistent soreness. It's important to pay attention if you experience this type of pain in multiple locations simultaneously, especially if it seems to be recurring or doesn't go away on its own, as this widespread joint involvement is a strong early signal of potential rheumatoid arthritis. Unlike injury-related pain that usually affects a single area, the pain of early rheumatoid arthritis tends to be more generalized across several joints. Number 2. Symmetrical joint involvement, a classic rheumatoid arthritis symptom. Rheumatoid arthritis often exhibits a characteristic pattern of affecting joints on both sides of the body in a relatively symmetrical manner. For instance, if you experience pain and swelling in the wrist of your right hand, there's a high likelihood you'll also experience similar symptoms in the wrist of your left hand around the same time. This symmetrical involvement can be a crucial distinguishing feature that helps differentiate RA from other forms of arthritis, such as osteoarthritis, which often affects joints asymmetrically. Be particularly observant if the same joints on both your left and right sides, like both wrists, both ankles, or both sets of finger joints, are experiencing pain, stiffness, and swelling, as this is a significant early rheumatoid arthritis symptom that warrants medical evaluation. Number 3. Morning stiffness lasting over 30 minutes, a key indicator of early rheumatoid arthritis. Prolonged morning stiffness is a well-recognized and significant early sign of rheumatoid arthritis. While many people experience some stiffness upon waking in rheumatoid arthritis, this stiffness tends to be more severe and lasts for a considerably longer duration, typically exceeding 30 minutes and sometimes persisting for several hours. This prolonged stiffness can make it difficult to perform everyday tasks, particularly with your hands and feet, such as making a fist or walking comfortably. The duration of this morning stiffness is often a key factor that helps doctors distinguish inflammatory arthritis like rheumatoid arthritis from non-inflammatory conditions. If you consistently experience morning stiffness that takes a significant amount of time to subside, it's a crucial early indicator of potential rheumatoid arthritis that needs to be investigated. What are your experiences with these early signs? Share your thoughts in the comments below. If this video provided value for you, please show your support with a like and subscribe for more natural health content. Don't forget to share it with anyone who might be interested. Number 4. Swelling and tenderness in joints, a manifestation of rheumatoid arthritis inflammation. Inflammation is a central pathological process in rheumatoid arthritis, and it manifests as noticeable swelling and tenderness in the affected joints. The inflamed joints might feel warm to the touch compared to surrounding areas, and can appear visibly puffy or enlarged. This swelling is due to the accumulation of fluid within the joint capsule and the thickening of the synovial lining. The tenderness means that the joints are painful to the touch or when pressure is applied. This inflammation can significantly restrict the range of motion in the affected joints, making it difficult to bend or straighten your fingers, toes, elbows, or other areas. Persistent swelling and tenderness in multiple joints are strong indicators of active rheumatoid arthritis inflammation and should prompt medical attention. Number 5. Fatigue and malaise, systemic effects of early rheumatoid arthritis. Rheumatoid arthritis is not just a disease of the joints, it's a systemic autoimmune condition, meaning it can affect the entire body. Early on in the disease process, many individuals experience overwhelming fatigue that goes beyond typical tiredness and is not necessarily relieved by rest. This fatigue can be accompanied by a general feeling of being unwell, often described as malaise, or a flu-like sensation without other cold or flu symptoms. This systemic fatigue is a result of the body's immune system being overactive and releasing inflammatory chemicals. Persistent and unexplained fatigue that significantly impacts your daily activities, especially when coupled with joint symptoms, can be an important early warning sign of systemic rheumatoid arthritis. Number 6. Low-grade fever, a possible systemic symptom of early rheumatoid arthritis. Some individuals in the early stages of rheumatoid arthritis may experience a low-grade fever. This fever is usually intermittent and mild, often hovering around 99 to 100 degrees Fahrenheit. It's another manifestation of the systemic inflammation that characterizes rheumatoid arthritis. While not everyone with early rheumatoid arthritis will develop a fever, its presence alongside other systemic symptoms like fatigue, loss of appetite, and joint pain should raise suspicion and warrant medical evaluation. It's important to note that a high fever is more likely to be associated with an infection rather than early rheumatoid arthritis. Number 7. Unexplained weight loss, another systemic manifestation of rheumatoid arthritis. The chronic inflammation associated with rheumatoid arthritis can sometimes lead to unintentional and unexplained weight loss, even if there haven't been significant changes in your diet or physical activity levels. This occurs because the inflammatory process can increase the body's metabolism and suppress appetite. If you notice a significant and unintentional drop in your body weight occurring alongside joint pain, stiffness, and swelling, it could be an early systemic manifestation of rheumatoid arthritis and should be discussed with a healthcare professional to rule out other potential causes as well. Number 8. Dry eyes and dry mouth, potential link to overlapping autoimmune conditions. Rheumatoid arthritis can sometimes coexist with other autoimmune disorders, most notably Sjogren's syndrome. Sjogren's syndrome primarily affects the moisture-producing glands in the eyes and mouth, leading to symptoms like persistent dry eyes, xerophthalmia, and dry mouth, xerostomia. While these symptoms alone do not diagnose rheumatoid arthritis, their presence in conjunction with developing joint issues, particularly symmetrical joint pain and morning stiffness, could indicate an overlap of autoimmune conditions and should be brought to the attention of your doctor for a comprehensive evaluation. Number 9. Numbness and tingling, possible nerve involvement in rheumatoid arthritis. The inflammation and swelling caused by rheumatoid arthritis can sometimes put pressure on nearby nerves, leading to sensations of numbness and tingling, particularly in the hands and feet. This is often associated with conditions like carpal tunnel syndrome, which is more common in people with rheumatoid arthritis due to inflammation in the wrist. If you experience persistent numbness or a pins and needles feeling in your extremities, especially alongside joint pain, swelling, and stiffness, it could be related to nerve involvement secondary to early rheumatoid arthritis and warrants medical assessment to determine the underlying cause and appropriate management. Number 10. Stiffness after inactivity, the gel phenomenon in rheumatoid arthritis. In addition to prolonged morning stiffness, individuals with early rheumatoid arthritis may also experience stiffness after any period of inactivity, even if it's just sitting for a relatively short time. This phenomenon is sometimes referred to as gelling because the joints feel like they have stiffened up or become difficult to move after being still. This stiffness usually improves with movement but can recur after another period of rest. Notice if your joints feel stiff and difficult to move after sitting for a movie, working at a desk, or any other prolonged period of rest, as this gel phenomenon can be a subtle but significant early sign of rheumatoid arthritis.